Physician-assisted suicide, commonly referred to as physician-assisted death, is the voluntary termination of one's own life by administration of a lethal substance with the direct or indirect assistance of a physician. It is important to note that PAS and euthanasia are distinctly different, as euthanasia is the intentional killing by act or omission of a dependent human being. Euthanasia can be both active and passive, voluntary and involuntary, whereas PAS is just voluntary and is the will of the patient.
The Dr. Jack Kevorkian case in the United States helped to demonstrate the need and basis for physician-assisted suicide today. Dr. Jack Kevorkian was an American physician and pathologist responsible for the deaths of over 130 individuals between 1990 to 1998. He was a prominent advocate for active euthanasia, supplying his patients with the drugs and means for death by either pushing a button, administering drugs to themselves, or by equipping his patients with a mask that administered a lethal dose of carbon monoxide. While active euthanasia is legal in the Netherlands, Belgium, and Luxembourg, it has been illegal in the United States throughout history. Due to the legality of active euthanasia, Kevorkian was charged with second-degree murder. His legacy lives on in the medical community today and is widely regarded as being the main catalyst for the physician-assisted suicide movement and subsequent controversy around the world.
Following Kevorkian's sentencing, Oregon became the first state to allow for terminal ill patients to die with lethal doses of medication prescribed by physicians. This is called the Death of Dignity Act and is founded on justification on an individual's right to die. Most importantly, in 2006, the U.S. Supreme Court gave the power to states to decide whether or not legalize physician-assisted suicide, and now 5 states have legalized physician-assisted suicide, with the general stipulations that patients are terminally ill with a 6-month prognosis, at least 18 years of age, a resident of the state that are seeking PAS in, and capable of making and communicating healthcare decisions and providing informed consent. The states are Vermont, Oregon, Montana, California, and Washington.
Physician-assisted suicide is an extremely controversial topic, both morally and legally, here in the United States and across the world. Some of the arguments supporting PAS are that patients would have the opportunity to die with dignity without fearing that they will lose their mental or physical capabilities. Therefore, patients can arrange final goodbyes with their loved ones when they are in a good condition, and this would also relieve the financial burden of healthcare on their family. One of the major arguments against PAS is that it violates the Hippocratic Oath, but the first statement of the Hippocratic Oath says that, first, do no harm, which can also apply to the patient finding ultimate relief from pain through death. Finally, with physician assistance, patients have a better chance of experiencing a painless death.
Commonly cited moral arguments against death with dignity and physician-assisted suicide include the idea that physicians violate the Hippocratic Oath and the principle of doing no harm by helping patients die, that choosing to take one's own life demeans the value of human life, and that allowing patients to choose death lawfully is a slippery slope that could lead to the abuse of the system and essentially legalized murder. Other critics of PAS assert that taking one's own life reduces the possibility of recovery and miracles, and that there is dignity in suffering and death that cannot be obtained by ending one's life by means of physician-assisted suicide.
Based upon the research available, we have all formulated our own opinions regarding the moral and legal implications of physician-assisted suicide. I believe that PAS should be legal under the circumstances that the patient is 18 and has a terminal prognosis of less than 12 months, along with other requirements by the Death with Dignity Act, and that PAS would alleviate the suffering of the patient. Also, I believe that the patient needs to make a fully autonomous decision and that the physician-assisted suicide need be in the best interest of the patient determined by the physicians reviewing the case.
I personally believe that PAS should be legal in all the states, as I believe that the patient's right to die and not suffer is in their hands. I believe the doctor's role is to serve the patients to the best of their abilities, but everything they do should benefit the patient. I do not think it's right for a doctor to stand by and let a patient suffer and let their life deteriorate if that's not what the patient wants. Finally, I believe that it is currently unethical that dying patients have to relocate to a state where PAS is legal and basically uproot their lives in order to die with dignity. If some states find PAS to be legal, I believe it should be legal everywhere, as healthcare is meant to serve the patients, not the doctors or lawmakers.
I believe physician-assisted suicide should be an option for all patients in every state within the life expectancy of 6 months or less and with a terminal illness. It is their autonomy to choose whether or not their life should continue. In the eyes of a doctor, seeing a patient in pain is not serving their autonomous needs and only serving the society's and law's needs. In conclusion, I believe serving the patient's autonomous decision by allowing physician-assisted suicide in each state.
I would say that I do support physician-assisted suicide. I say this because the patient's time has significantly reduced suffering, and they would die knowing it was their choice, as well as possibly saving functioning organs for later use in someone else. While the patient's life and suffering is cut short, so is their family's pain. The family also gets the added benefit of knowing when the patient is going to die so they can properly prepare. Another reason I support physician-assisted suicide is the fact that the patient might try to commit suicide by other, more messy and traumatic ways if they do not have this.
In conclusion, though I personally agree with physician-assisted suicide as it is stipulated now in the United States, I can see how it may be morally objectionable, as the line between physician-assisted suicide and active euthanasia, which is legal everywhere, is very thin. While I know ample thought and debate have gone into legalizing physician-assisted suicide, I believe that we as a society should search for a deeper moral difference between PAS and active euthanasia to ensure that we are not getting caught up in the procedural nature of death in the United States, and to be able to see each case in a more humanistic manner so that we can adequately and morally advocate for the legalization of PAS in the remaining 40